Hello, Year 11. Today's lesson is all about controlling fertility. So, there are two reasons to want to control fertility: to either reduce it or to increase it. If you are reducing it, you are usually reducing it to prevent pregnancy. Now, there are several different ways to do this. There is barrier contraception, and the whole point of barrier contraception is to stop the sperm meeting the eggs. Now, you have male and female condoms. Male condoms cover the outside of the penis. Female condoms are inserted into the vagina. Condoms are the only form of contraception that protects against sexually transmitted diseases. There is another type of barrier contraception, though, that is a diaphragm. Now, a diaphragm is a plastic cup that folds and bends and is inserted into the vagina and fits over the cervix. However, it is only effective when used with a spermicide. Now, a spermicide is a liquid that you add in at the same time. You then have hormones as a way to stop and reduce fertility. Now, daily, you can take the combination pill, which is the combined oral contraceptive pill, and it contains estrogen to inhibit FSH, our follicle stimulating hormone that we learned about last lesson. And this prevents eggs maturing, because FSH would cause eggs to mature. If there's no FSH, there's no maturing eggs. Because it is the combined pill, it also contains progesterone hormone. And what progesterone does is produces a thick mucus that prevents sperm from reaching the egg. Now, you can also get this in patch or in a 3-month injection. So a patch you stick on your skin and it stays there for about a week and then you change it. 3-month injection, you only have to go once every 3 months to go and see the doctors to get an injection, or the nurse might do it as well. Now, these are 99% effective if taken properly. You have to read the instructions. If you have diarrhea or you have vomiting and sickness, it can affect the effectiveness of the pill. It also has side effects of nausea and headaches. We then have the progesterone only pill, which again you take daily, sometimes referred to as the mini pill. And what this does, as previously mentioned, progesterone causes a thick mucus which prevents the sperm from reaching the egg. Okay, it prevents the sperm from reaching the egg. You also can have an implant, which is a plastic device which is inserted under the skin and releases progesterone. Once inserted, it can last 3 to 5 years, depending on the maker of the implant. You can also have an IUD, or an intrauterine device. So from the name of it, you can see it's inserted into the uterus wall, uterine uterus, and it's T-shaped. Now, there are 2 types of IUD. There is a plastic one that contains progesterone, and as we know, progesterone causes a thick mucus that prevents the sperm from getting to the egg. But you can also have a copper one, and the copper actually kills the sperm. It prevents sperm survival. So they're the hormonal types. You then have some other types. Sterilization. This is where you have the fallopian tubes or the oviducts cut in the females, or the sperm tubes cut or tied in the males. In the males, the term we usually use for it is a vasectomy. Then you have natural methods, timing with the cycle, so not having sex when the woman is ovulating or near ovulation, 5 days before, 5 days after, because it can happen that they ovulate late. And then obviously the main way to prevent and reduce fertility is to abstain. Don't have sex. If you don't have sex, you won't get pregnant. Well, abstain from any sexual activity at all. If you have any sort of sperm near the vagina, it can occur. We then have the second way of controlling fertility, which is increasing fertility. Okay, so for some women, hormone levels are actually too low, and the main two hormone levels that are too low is low FSH, follicle stimulating hormone, which means no eggs mature, or low LH, luteinizing hormone, which means no ovulation. So they may have the right level of FSH producing mature eggs, but actually they're not being released from the ovary. If they're not being released from the ovary, you can't have fertilization, and therefore you can't make a baby. So how do these women get help? How do we increase their fertility? We give them fertility drugs. The problem is there are downsides to it. Now, the benefit is obvious. They get pregnant. The downside is it's not very effective. It's only about 26% effective. So effectively a quarter. So only 1 in 4 are going to work. There's a risk of multiple births. This is not because of the process, it's because of the number of eggs that are sometimes inserted into the uterus to see if implantation occurs. The more eggs you insert, the more chance you have of one actually taking and turning into a pregnancy. So if they're inserting more eggs, it could be that you have multiple eggs that implant, so you end up with twins or triplets. The woman who's using the drugs, these fertility drugs, to improve her chances of getting pregnant could actually have a reaction to the drugs. And then the byproduct of it are unused embryos. And this comes onto our ethical and moral grounds. What do we do with those unused embryos? If the woman has managed to become pregnant, what does she do with the embryos that are left over? Now, this whole process is usually done through something called IVF, in vitro fertilization. Before we actually get to the IVF, there are many different stages that a woman has to go through. There has to be tests to see whether it's the female or the male that's the problem in not getting pregnant. They have to have a look at what the hormone levels are. They will just try and give them fertility drugs to help before we actually get to the in vitro fertilization stage. And in vitro fertilization is where you take an egg and a sperm and you inject the sperm into the egg, known as intracytoplasmic sperm injection, ICSI, where the sperm is injected directly into the egg, and then they are implanted or injected into the uterus to hope that implantation takes place. It is a very, very long process, like I say, with only a quarter, just over a quarter chance of it actually working. But women who have very low fertility or are with a partner who has very low fertility will use this to try to get themselves pregnant.